So first off, you can do a technique where you lift your elbows up, and that raises your stomach, your esophagus up as well. And it also raises your stomach. You go on your tippy toes, and then you fall back, and then you bring your elbows down. Basically, it's just taking if here's your esophagus, you're just kind of flicking it down a little bit and allowing that stomach to come down. That's all it is. You're kind of just flicking it. Or as a chiro, you could deep breath in, you get your fingers right under that diaphragm area, and then as they breathe out, the diaphragm comes up. And so as it comes up, you're kind of tractioning it down as it comes up. So that's kind of the philosophy there. If you're seeing an osteopath or a chiro, you can do manual manipulation, or you can do and then drop it. So that can help kind of manually move it. But in the end, what's the solution? Get the inflammation down. If you get the inflammation down, that tissue's going to relax. Just like if you had a shoulder or elbow, start to heal it, get the inflammation better, and now it starts to fall in the right place. So just kind of remember that philosophically. All right, let's keep on rolling. So hiatal hernia, that allows upward movement of the stomach contents, especially when laying flat. So now it's going to be harder for things to drain from the esophagus into the stomach. And so when you go flat, things are going to come upwards a lot more. So left side sleeping can be helpful. Left side sleeping can be helpful. Also head elevation. So we'll recommend like an acid reflux pillow, like a 15-degree wedge pillow. That's like a foam one, or you can use some pillows to prop it up, or you can get some bed risers under the back 2 legs of your bed and just prop it up 15 degrees. That can be helpful just to allow gravity to empty things better. What we'll also do is we will try to make sure the patients don't do any big meals before bed. Try to make sure we do at least 3 hours. And maybe we go a little bit lower on the acid and make it an easier to digest meal at nighttime. That's another big thing that we'll do to help improve the inflammation and make the food easier to digest and empty. We'll also add in things like bitters. Bitters can be super helpful because they trigger that MMS, MMC, migrating motor complex, which then allows food to empty into the stomach better. And again, of course, having enough acidity is a big trigger for that. It's really important. But if someone has gastritis, they may not be able to handle acid. So then we're going to use bitters and maybe enzymes and just use things to make the digestion very easy to handle and not create inflammation. And then using gravity to help us.